Now, I know it is after lunch and near the end of the day, but I am going to talk to you about something very important to your employment with Dallas ISD, your benefits. My name is Deirdre Bell Hunter. I am the Senior Director in the Human Capital Management Department, and I oversee the Benefits Department. So today we're going to talk about benefit resources, the benefit options that you have here in the district, key features of our benefits plan, and we're going to walk you through how to enroll in your benefit options. So the first thing I want to talk about is the benefit resource page. It gives you lots of information to allow you to make decisions about your benefits. We suggest that you start with this page as your resource. This particular page will guide you to the Annual Benefits Enrollment Guide, which will give you numerous details about your benefits. It will also give you information about medical, vision, dental, and life insurance options. Once you check out the benefit options that are available to you, you'll be ready to view your personal details inside the Dallas ISD Benefits portal. When you get to the portal, you will need to set up a personal account. You'll do that by using a username and password. Your password that's preset for you is your employee ID, along with a 12-digit password, which is 2 digits of the birth month, 2 digits of the birthday, the last 4 digits of your birth year, and finally, the last 4 digits of your social security number. You do not have to write that down. I see some people writing. That information is located on the inside page of the portal, and they will guide you and assist you with enrolling. Once you're inside the portal, you can look at all the plan options as well as your personal demographic information. If you need assistance when you're going through this process, we encourage you to please contact our benefits call center at 972-925-4000. We have representatives who will speak with you in both English and Spanish Monday through Friday, 7 days a week, from 7:30 to 5:30. So inside our district, we have 3 plan options for you. We have the TRS-ActiveCare 1 HD plan, the TRS-ActiveCare Select plan, and the TRS-HMO plan. Each plan is a little unique, and I'm going to walk you through a little bit of the details of the plan. However, we do encourage you to go to the Benefits Enrollment Guide so that you can go through all the nuances of the plan. But I'm going to give you a general overview of each plan this afternoon. So the first plan I want to talk with you about is the TRS-ActiveCare 1 HD plan. This particular plan allows you to pay very low premiums out of your paycheck. That is a plus for many employees. However, you do have to meet a higher deductible. That part comes out of pocket. So before you use this plan, you have to be sure and understand that you are going to incur most of the expenses for your services, but you'll do so at a lower rate, a lower monthly rate out of your paycheck. While this plan is the least expensive plan from a premium perspective, you should carefully evaluate your expenses and anticipated healthcare needs to be sure you can afford the higher deductibles if you have to utilize the benefit. Finally, with the TRS-ActiveCare 1 HD plan, you are eligible to set up and contribute to what we call an HSA, Health Savings Account. That's a tax-favored account. The district does not offer an HSA. Many of you may be familiar with it. It is offered through your local bank or your local credit union, and it will assist you with expenses if this is a plan that you select. So the next plan I want to talk about is the TRS-ActiveCare Select plan. This is your second medical option. Now with this plan, the deductible is lower in comparison to the other plans, and you have a set copay when you go and get medical services. if you're considering the TRS-ActiveCare Select plan option, you have to understand what an ACO, Accountable Care Organization Network is. This is a group of doctors, hospitals, and healthcare providers who will work together to coordinate a high-quality benefit for you that is cost-effective. So with this plan, you have to use a specific network of doctors. Otherwise, the plan will not cover you. The provider network offered to you is also based on where you live. So if you live in and around Dallas, this plan will work for you. If you live in Dallas, Tarrant, Collin, Denton, Ellis, Parker, or Rockwall County, you will be required to use the providers who belong to the network. You can search for other providers in your area if you live outside of that area, but those providers will be considered out-of-network providers, and you will have to check to make sure that your expenses would be covered on the plan. So your third option is the HMO provided through Scott & White Health Plan. With this plan, you pay the highest premiums, but you have the lowest deductible. You also pay a set copayment for all of your services at the time you receive services. Except in a true medical emergency, you have to seek out an HMO provider. Otherwise, the plan will not cover your benefit. It's also important to note that the HMO plans often provide additional resources to members that help them live healthier lives, such as if you have chronic medical conditions like diabetes or high cholesterol, high blood pressure, or asthma, they often have additional resources available to you to live a healthier life. Now, some of you we've been talking with outside, so before I move on, there have been some people who've talked about the ActiveCare 2 plan. We're not discussing the ActiveCare 2 plan here today because unless you're currently on the TRS-ActiveCare 2 plan, it is not available to you. So if you are new to the school district or new to a TRS institution, you may not select ActiveCare 2. When you enroll in the portal, you will not see it as an option, which is why we didn't discuss it today. But for anyone in the audience who currently has ActiveCare 2 and would like to discuss that option, we will be available to discuss it with you. So one of the things we encourage you to do is visit the TRS website to get more information about all of your healthcare plan options. They have numerous resources available on this website. This website includes links that help you find doctors, but it also allows you to talk with a benefit expert, and you also have access to a 24-hour, 7-day-a-week nurses line through the TRS website. So I want to talk a little bit about our dental benefits. We offer 4 dental benefit options: an HMO, an EPO, a PPO, and a dental discount program. Now you can review premiums for each of these plans through the annual benefits enrollment guide posted inside the portal and on the benefits website, but I want to talk to you a little bit about the nuances and details of the plan. So let's start with the dental HMO plan. On this plan, you don't have to meet a deductible before the plan starts paying out a benefit. And with this plan, dental wellness screenings are covered 100%. So you have set copays for dental services such as fillings and crowns and cleanings. If you choose a United Healthcare primary care dentist inside the network, your dental benefits will be covered. Now on the EPO plan, with the dental EPO plan, it's preventative care. For example, it covers your checkups and x-rays, and that's covered 100%. But you do have to meet a deductible for all other services such as fillings and crowns. And then you pay a set copayment for all other treatments. You may choose any dental provider. However, the cost is lower if you choose a provider inside the network. The dental PPO is your third option. On this option, you pay the highest premiums with this plan, and you do have to meet a deductible for all of your services, including preventive care. Once you meet the deductible, you and the plan will share cost through like what they consider a co-insurance, meaning that the plan is only going to cover a percentage of the cost and you will have to pay the balance of your expenses. This plan also offers a network of providers for you to choose from, and you do save money if you stay inside the network on this plan. Now, the dental discount plan is your fourth option. This is not really a full benefit plan, but it does help you lower the cost if you take out one of our other dental plans. This plan is not insurance, but it will provide you access to discounted services, which can help defray some of the expenses that you may encounter if you choose one of the dental benefit providers. So I want to talk a little bit about what the district offers with vision. And we basically have two plans through United Healthcare. Both plans allow you to visit a healthcare provider, and the cost is lower if you stay within the network. Both plans allow you the opportunity to visit with a $10 copay and receive an annual exam. And you'll have discounts on eye surgery like LASIK, etc. The difference in the plans are in the cost of frames, lenses, and contacts. They vary by plan. So you have to actually access the benefits enrollment guide to see the differences based on the needs that you have for each plan. Flexible spending accounts. We've received several questions today about flexible spending accounts. FSA will allow you to set aside pre-tax dollars to pay for your healthcare expenses and dependent daycare expenses. The health and dependent daycare accounts are separate accounts. You choose an annual dollar amount that you wish to contribute to both plans. Your contribution is deducted in equal amounts monthly from your paycheck before taxes are withheld. The IRS determines the expenses that are eligible for reimbursement through your FSA account. If you'd like to see a list of reimbursable expenses, we encourage you to go to the IRS website and look at 502 and 503. Now, this is an important note. If you're thinking about an FSA, you gotta remember that there is a use it or lose it rule. You need to use all of the money that you put in the FSA annually before a set deadline. You have to think about your estimated expenses and make sure you're going to use all that you set aside in your FSA. If you fail to use your FSA by the deadline, you lose the money that you've set aside in your FSA account. So I want to talk a little bit about life insurance. So the district provides basic life and AD&D benefits to all district employees. You may choose additional life insurance at your own expense, and you can look inside the portal and view the applicable premiums for things that you might be interested in. We also provide you with several supplemental voluntary insurance plans that may help you meet your financial needs when unexpected things happen. For example, if you require hospitalization, you face a cancer diagnosis, you're disabled and unable to work, or you need long-term care at home or in an assisted living facility, you may be interested in some of our other voluntary supplemental insurance plans. The district also provides personal legal plan options. This is offered through Hyatt Legal Plan. This plan's coverage allows you to be eligible for particular legal expenses when you're using an in-network attorney. Some of the issues that are covered on the plan are noted on the slide. They help you with family matters such as divorce or wills and estate planning. The legal plan also provides you with unlimited advice and consultation services regarding identity theft education and identity theft prevention. They also assist with credit issues, and they have some other options. They are listed on the website. You can get more information if you go to legalplans.com. So before we wrap up, I really want to take just a little time quickly to talk about the district's EAP plan, which is our Employee Assistance Program. If you're facing a crisis or you just need someone to talk to, the EAP toll-free number is 1-800-479-9639, and that number is answered 24 hours a day, 7 days a week, and someone will be there to allow you the opportunity to have conversation with a counselor. Those conversations are completely confidential. In addition to any phone support that you may need as an employee, you and your family can also receive 6 in-person sessions with a counselor per year at no expense to you as the employee. If you'd like more information about EAP, you can go to magellanhealth.com/member, and they have some other resources listed directly on the website because they have several web-based tools, and you can get information on self-help tools and other articles that you might find interesting. So, when you're ready, we are asking that you follow these 5 steps to complete your enrollment. First, we encourage you to learn more about your benefits and benefit options. Today's presentation is merely an overview. There are more details available to you through the Dallas ISD Benefits website, our annual benefits enrollment guide, the benefits portal, and the TRS website. Second, when you have a good understanding of all of your options, you should also decide if you'd like to cover an eligible dependent. If you're covering dependents, note that you will need to provide their names, their birthday, and the Social Security numbers in order to enroll. Be sure to have this information handy and ready for your enrollment. Thirdly, register inside the benefits portal. All the registration is electronic and done online. So you'll go in and you'll select your coverage at benefits.dallasisd.org. You'll set up a username and password, and once you've registered, follow the prompts to continue your benefit enrollment. Fourth, designate your beneficiary for the district-provided life insurance. And lastly, number 5, you will be prompted to review your elections at the end. Right when you get to checkout, follow the prompts and be sure to print and save a PDF version of your contribution statement. Lastly, don't miss the deadline. New hires have 31 days from the date of their start to enroll or decline coverage. So from the first day of work, you have 31 days to enroll in your benefit. If you do not enroll during this 31-day time period, you will not have coverage, and coverage will not be available to you through the district until the next school year of July and August of 2019. So we encourage you to get inside the portal and enroll during your 31-day window. Lastly, I just want to say thank you so much for listening and taking time to receive an overview about your benefits this afternoon. I know it's been a long day, and now we're in the middle of the afternoon. I hope you found today's presentation to be helpful to you. Please be sure to visit the benefits website. At the Dallas website, you can go directly to the site, or you can click on benefits, departments, and on the main website page, Finally, please feel free to contact our benefits call center or our internal benefits department if you have questions. And I'd like to know, are you ready to select your benefits? Wonderful. I heard lots of yeses, so we were hoping you would say yes. So outside this door, after we've closed for the afternoon and on your way outside, we hope that you'll stop by the benefits area that will be located at the 2 exit doors near the back. The entire benefits team, as well as every benefit carrier that we have available to you, is here to assist you this afternoon. So please stop by with your questions and concerns. We're here and we're ready to help you. If you just have questions, we're happy to do that. We have a handout for you that will assist you, kind of a quick guide on enrollment. And we have the benefits team ready and available to you at their laptops if anyone would like to sit down and enroll in their benefits this afternoon. Thank you so much for your time. Have a wonderful afternoon.